Welcome to another podcast from Odell Technology. Today we're talking to Iacob Mathiesen, the Chief Scientific Officer of Otivio in Oslo in Norway. Iacob has a remarkable background, and one of his other current officers is also the chairman, Norway Health Tech. Hello, Iacob.
Hi, Stephen. Nice to see you.
Nice to see you, and thank you for joining us today. So, Iacob, would you mind giving the audience a bit of a background on who you are and how you ended up where you are today, please?
Sure. I am a neurobiologist by training. I got a PhD in neurobiology, worked with nerves and muscles, learning and memory. And the last 13 years, I worked with Otivio. So I started Otivio in 2010. And this has had a not a very straight path forward. We've done a lot of different things. It's based on technology from University of Oslo. It was a discovery made by two medical students who realized how they could improve blood flow to limbs by alternating pressure around that limb. They started a company which went bankrupt in 2008, and I bought the bankruptcy board in 2009 and started Otivio 2010. But before that, I had done work I discovered a method of getting genes into muscles, which was patented and was the basis for a company called Inovio. This company I ran for 5 years with venture backing, and it was purchased by a US listed company, which is called Inovio today. So they took our name, and it's on the NASDAQ, and it's been working on gene-based vaccines using our delivery technology.
Wonderful. Okay, that's quite an extensive background. Thank you very much. Tell me a little bit about Flowox, if you wouldn't mind, the product that comes out of Otivio.
Yes, so the technology is, as I said, based on work done at University of Oslo, and what it does is to create an oscillating negative pressure, so it's suction on the leg primarily, but it can also be done on your arms. But it's an oscillating negative pressure which leads to rapid changes in blood flow velocity. And the Flowox device, which is our core product, it's actually now a second generation product. So the first was used it was CE marked, but it was used primarily for clinical trials. Now we have a second generation device, which is commercialized. So it's now on the market in Europe and also in other countries of the world. But what it does is to improve blood flow, basically. And it's primarily used for patients with peripheral arterial disease. So patients with smokers' legs, with quite a lot of diabetics with wounds or chronic wounds are using it. And it's for all sorts of different conditions where you need to improve your blood flow for various reasons.
Do you know the mechanism of action? Does it reanatomize the arteries or the veins?
Well, we have worked quite a lot on looking at the blood flow parameters, and acutely when you apply the negative pressure, it's physics. So you just suck blood down into the leg, and then you can't keep it there forever. So you need to turn the pressure off, and it goes back up to your heart, of course. If you don't have this oscillation, then you get edema, or you get too much blood in your legs. So you have to turn it on and off. And it's sort of part of the uniqueness of what we're doing is to have this right pattern of on and off. So the mechanism of action for this acute effect is just pure pressure changes.
So it's very different to negative pressure wound therapy, isn't it?
Well, it's totally different from negative pressure wound therapy. Negative pressure wound therapy is primarily to keep the wounds clean, take away exudate, keep the wounds sort of in a controlled condition, but it doesn't really improve blood flow to the wound site. Our technology is treating the whole leg, and it's primarily treating or improving blood flow. So it's a totally different way of attacking a non-healing wound.
Okay, so there's no similarity. Tell me, through this journey that you've undertaken with Otivio, what have been some of the pain points you've experienced, if you wouldn't mind?
Yeah, there are always a lot of pain points. So I don't know where to start, but you know, the first thing we had to do is to create a device which was easy for patients to use. So our first generation device was a bit big, heavy, didn't look very nice. It was a bit complicated for people to use, but a lot of the patients that were able to use it, they were happy. They got much less pain. Their wounds healed. They prevented, or we prevented, amputations.
Yeah.
But then to get this system, you know, into full commercial status, we had to redesign the whole product, make it cheaper to manufacture, and also make it much more user-friendly. And it might sound easy to have a device where you insert your leg into this pressure chamber and then close it off and then create this oscillating negative pressure. It's all physics and mechanics.
Yes.
It should be simple, but if you have lots of different leg sizes, lots of different personalities, lots of different types of people are doing it, you need to have something which is very simple. And we spent a lot of time to create a good user-friendly solution. So that's been one pain point, which I think we have overcome. And of course, now I think the biggest challenge we have now is commercialization, to get payment solutions in place. So we've worked with hospitals in Norway. So it's now available on all the big hospitals in Norway, or at least most of them. But it's still difficult to get it into routine use where they pay on a regular basis with, you know, with invoices going in, money coming out. It seems to be very difficult to get new technologies that are not replacing anything, something totally new that this is. It's difficult to get it into the systems, but we are getting there.
Where else outside of Norway are you working?
So we have a good distributor in Germany. We are in Switzerland, I think, at the moment. We have a distributor in Singapore. Australia are doing quite a lot of good work.
Good.
We have activities in Sweden and Finland, about to start in Denmark a little bit. So we're trying in different markets to see where we can actually get these payment solutions up and running. I think that's the most challenging thing. I think for us, it's sort of strange that it's not being paid, because we hinder amputations, we heal wounds, which are extremely costly, but because there are no existing reimbursement codes that they can use, or it's quite a lot of work in the beginning to get that established.
And it's used in the community, or it's used in a hospital?
No, this is all used in the patient's home. So this is another really rewarding thing about this technology, is that it's a home treatment device. It's like home oxygen or CPAP or home dialysis or whatever. It's something you use at home, and you enable the patient, and the patients get really happy because they can do something about their own condition. So I think that's it's a really good thing, and it keeps them away from the hospitals. You know, a lot of these patients with peripheral arterial disease, they visit the hospital quite often because they have pain, they get wounds, they have lots of troubles, and it's a very costly patient population.
Tell me, does it reduce claudication?
Yes, we have done a fairly, not very large, but we've done a 70 patient study, a double-blind randomized control trial at 3 hospitals, major hospitals here in Norway, where we had a pressure chamber and a pump which created a much lower pressure than what's needed in order to get this rapid changes in blood flow. So that served as the sham control. And in this study, we were able to show a remarkable and a really nice significant improvement in these patients' ability to walk after 3 months use. They had to use it every morning, every night for 1 hour. But this is something that these patients do most of the time. Anyway, they sit still and watch TV or read a book or have a beer or whatever. And they can use this device. It's comfortable, and they can do it in the morning and 1 hour in the afternoon. And after 3 months, they can walk longer. So
so obviously there's a lot of benefits to that particular application, including reduce on opioids and reduction on painkillers.
Yeah.
So tell me, are there any unintended consequences from your research and the work you've done in any other fields?
Well, so a few years ago, about 3 years ago now, we were approached by a woman who had heard that we could reduce leg pain because she had scrutinizing leg pain every night. She had multiple sclerosis and lots of cramps or spasms.
Yes, of course.
And you know, when she came, I said, well, this is not going to work, but for, you know, just to do a good job, I did some research and try and find out if there was any links between blood flow and cramping or pain or leg pain in patients with multiple sclerosis, and I couldn't find anything. So I told her that this is not going to work. There's no point that you should bring this home. It's not going to work. But she was very persistent, and it's a woman that we know. So I thought, well, you might as well get one of these systems with you home and try it, because it's not going to harm you. It's just a very low pressure device which improves blood flow to your limb. So it doesn't, you know, it's totally safe. So I gave it to her, and she called me the day afterwards and said, Iacob, this is the first time in 7 or 8 years where I haven't had cramps or pain in my leg. And I thought, this must be placebo. This must be, you know, this is probably the perfect example of a placebo effect. But she continued to use it, and she used it for several months, and she had a couple of times where the device failed and her symptoms came back. Whenever it was restored and she started treatment again, the symptoms went away. She had to use it every night for 1 hour in one leg, but that seemed to help her whole body, not only the leg she treated, but also the other leg and also her whole upper body.
Yes.
And we didn't really understand how this could be, and we you know, it was very strange. I tried to read a lot about it, and I really couldn't find any connections. And then we tried on another patient, and the results were just remarkable. I mean, it was
another MS patient.
Yes, well, we had another MS patient, and then we had a small girl with cerebral palsy. She could not extend her legs. She had so much spasticity that she was just walking around on her knees. Yes. Lots of pain, lots of medication, and she used it. And just after the first session, when she used it, she actually used it on both her legs. And after half an hour to an hour on each leg, she were able to stand up.
Yes.
She continued to use it, and she was able to start walk training. She, you know, her medication use dropped dramatically.
Absolutely.
So she got a totally different life. And we've had several of these primarily MS patients who had scrutinizing pain or spasms or night problems in particular, who use it for 1 hour, and for some reason it really relieves their symptoms. We've done a pilot study now at the Norwegian National Center of Excellence for MS Research in Bergen, where we confirmed these results. And we are now currently doing a double-blind randomized controlled trial in Scandinavia. So at Karolinska, which is in Copenhagen at the National Hospital, and 3 or 4 other sites. So hopefully before the summer, we will have data confirming this in a double-blind manner.
That's very exciting news.
It's very exciting. And you know, we don't know exactly how it works. I have my theories. I think one of the things that this device is doing is I said, it sort of pulls blood down into your leg. And then, you know, we can't have a constant negative pressure. That's why we have because then you just get lots of pooling. But before we turn pressure off, we know that the blood flow velocity goes down. And that's a sign of activation of this veno-arterial reflex, or the postural reflex, the same reflex that you activate every time you stand up.
Yes.
So the blood would sort of pile down into your legs unless you had this reflex that constricts your arterial vessels and reduces the blood flow. And we know that this reflex is activated every time we turn on the negative pressure. So in this setting, we sort of turn on and off this reflex again and again and again, or 3 times a minute. And my guess is that there's some sort of sensory signal, whether it's what this reflex is, I don't know, but something that goes up into the spinal cord, maybe all the way up to cortex, I don't know. But we have in our pilot study in Bergen, the neurologist said that the reflexes in the arms of the patients who've used it for 4 weeks was actually reduced. So it seems to have an effect which is not only on the leg you treat, but the contralateral leg, your arms, and also several of the patients, they claim that their intercostal muscles are smoother, so they can breathe easier.
Breathe easier,
yeah. And it's a bit strange because this is not something that we tell the patients before they try it, but they come back to us and report the same things. So it's probably a placebo involved in this, but it's very surprising that they all have the same sort of outcomes.
Absolutely.
Based on.
And tell me, with the results from Karolinska, when are you looking at publishing those?
So we hope to get the top line data before the summer.
Yes.
But then there is also a 6 months extension period where the study is unblinded after 4 weeks treatment, and then patients who want to continue are asked if they want to continue for another 6 months with the active treatment.
All right.
Okay. So that will take the remaining of the year, I think.
That's okay. That makes well. That's absolutely. For me, when you first told me some time ago, I was quite excited about it. That's all very exciting news, and I wish you the very best with the publications. Tell me, with regards to chronic wound care, you've obviously got published studies that you would be prepared to share with people?
Sure.
If they want to get in touch with you, we will provide the details and all the information we possibly can. With regards to the outpatient coding you're having issues with, is that particularly in one market or is it across all markets?
Well, I think it's probably across all markets, but in Australia, it's a bit different because of this nice system where patients can actually handle a lot of the funds that they get for devices or treatment themselves.
A good system.
It's a very nice system, but we're just in the beginning there to see how we can do that. Right. But I think in most of the other countries, there aren't really any codes for this sort of treatment. So we are looking at different ways of doing it. We are, for the MS, in the MS field, we're actually thinking about providing it as a rental model so the patient can just rent it. And we were thinking about renting it directly to the patients. So they have to sign up with a neurologist online, for example, and get the prescription.
Absolutely.
Once we have the prescription, we can ship the device, with a car or some sort of delivery service.
Yes.
And then they can start using it straight away. It's not really complicated, so it's sort of something that they can try it for a few weeks for free.
Yes.
And then, of course, if they have the benefit that we've seen in so many patients, then we can ask them if they would pay. Oh,
that's a wonderful offer. Try before you buy.
Yeah.
You don't hear that in medtech that often, do you?
I don't know.
I think it's fabulous. I think what you've done, what you've achieved over the last few years is fabulous. It's very exciting for someone like me to hear of these wonderful unintended consequences of actions of yours.
Yeah, no, that it would be fun to see this out, and I'm quite sure that this will get out in the market because the effects that we see is just it's the most rewarding thing for us who work with it, is that you see these patients who really benefit from it, and it changes their lives in many ways.
Absolutely, it would change their lives. And medication is quite personalized, isn't it? It's some medications work, some don't. It's just something that we don't really understand yet.
No.
Okay. Well, look, I wanted to thank you very much for your time on this particular occasion. I look forward to talking to you again. So thank you, Iacob. Your details will come up on the screen in a minute. And please, if you're interested, and I'm sure you are, please contact Iacob. I've known Iacob for an awfully long time, and he's probably one of the smartest people in this business that I've ever met. All right. Thank you.
Thank you very much, Stephen.